Have you ever been to therapy and when you finish, even though you felt like you've spoken about a lot and you've done a lot of work, that you're a bit shaky, that it's changed your mood and you can't really snap out of it? Maybe even the next day you're still feeling the same feelings that came up from that therapy session. I call that a bit of a therapy hangover, but in psychology we might call that re-victimisation. And what happens is that sometimes when we talk about something traumatic that we're not ready to speak about, that isn't held in safety, or the session isn't closed safely, we will re-experience the trauma that we have spoken about in the session. My name's Laura, I'm a psychotherapist. I live here in the UK, and I'm just making a video to help you look after yourself in between sessions. So welcome if you've come here either as one of my clients or someone who has stumbled upon this video. So you might have had a session that felt a little bit heavy and you're still feeling that sense of weariness. Maybe it's the first time you've brought something up. Maybe it's the first time you've spoken about it to anyone. And we don't know what that's going to feel like before we do it. But once we've done it, we know what we're experiencing. And if it's too much, in the session you can tell your therapist, I'm not sure if I'm ready to be speaking about this yet. And your therapist can help you with grounding. So that means bringing you back to an emotional state that feels safe. And you can ask your therapist to help you with that. But if it gets to the end of the session and this comes up in between sessions, that's what I want to talk about for you today. So how do we notice that we're getting this re-victimisation experience? So it might be that we're feeling a lot of stress, a lot of anxiety. Maybe you can feel it in your chest. It might be behind your eyes. Wherever it is in your body, we're noticing where it is in the body and what that feels like. So if you can tune into your body and listen, then you will at least know, you've got the information to know what your body is experiencing. So you feel what you're experiencing by acknowledging it. So you notice what's going on in your body, checking in with different parts of your body. And then instead of saying, I'm feeling this because, we don't do that. We just go, I am feeling this and it is here. And we allow ourselves to feel that. And it can be really difficult because when we are noticing that we're experiencing something, we take ourselves out of the experiencing. So it takes practice, but that is the best way to start being able to experience that. And then if you need to, noticing the difference between where you're at, usually what's your baseline, and where you are in that moment in between your sessions where you're feeling like you really could do with some extra support. So instead of calling your therapist and asking for an emergency session, you can try some techniques that might help you. So there is some ways that we can trick our body into thinking that we are safe. And I say trick our body because our body might think that we are unsafe, even though we are physically safe. And so we're not dealing with logic, we're dealing with emotion. So if our emotions are telling us that we are unsafe, we need to tell that part of our body that we are safe. So what we do is we think about all of the ways that our body reacts when we're in danger. So our heart rate might go up, we might start to sweat, our digestion might slow, you get those feelings in your stomach, you might get short of breath. But breath is the one thing that we can control. Out of all of those automatic processes, we can control our breath. So if you can take some slow breaths, and I have got some videos on here that will show you how to bring your breathing nice and slow and to check in with your body. So if you want to check those out, you can do so. When we slow our breath, our body thinks, hang on, I'm breathing slow, I must be safe. And then the other automatic processes that are happening because our emotions are telling us that we're unsafe start to slow as well. And so when we can get our body to feel the reality of we're actually safe, we're not experiencing the thing that we spoke about in therapy, then we can start to think logically about it. But until that point, we're dealing with emotion, and emotion doesn't respond well to logic, although it feels like we want to be in control and we want to logic ourselves out of it. It's really hard to do that. So you slow your breath. You might then need to connect with space and time. So you want to see where you are in space and time. So noticing what's around you, feeling what you're experiencing. So feeling your body weight sitting in the chair, noticing where the light's coming from in the room. There's quite a few different exercises. I know there's the 5, 4, 3, 2, 1 exercise, which you can look up. There's lots of things that you can do to tell your body where you are in space and time. So because we're able to, 1, tell our body that we are safe, and 2, remind ourselves where we are now. We are physically safe. We've now been able to ground ourselves. And this might be something that you have to repeat a few times. It might be something that you can't do in the middle of a meeting or while you're working with a customer. You might have to take yourself off and just privately do some slow breathing and to bring yourself back down. But if you can do that, you're teaching yourself how to regulate. And regulation means that next time you're in therapy and you want to talk about something that has been really difficult in the past to talk about, that you're able to catch, when is it that I go beyond what's safe for me to talk about? Because if I'm going beyond there, I'm going to experience this again, and this is not a pleasant experience for me in therapy after my sessions. And so I want to be able to talk safely and to process things, but at the rate in which my body is able to do so. Now, if you're getting therapy and there's a limited number of sessions, it can be really difficult because you might not reach that point of safety to be able to process things before the 6 or 8 or 12 sessions is up. However, it's not wasted because the process that you go through to build that safety can then be used again and again. You've learnt skills to be able to then go to a new therapist or to extend your work and to be able to get to that grounding, safe space much quicker than before you had those sessions. I would always recommend working with someone longer term if it's an option, but I'm aware that it's not always an option. So don't think that just because you've had a short amount of sessions that it's been wasted, because it hasn't. If you've learned how to be responsive to your body, if you've learned how to listen, then that's been useful, and you're going to be able to go deeper and process more because of those skills that you've learned. Thank you very much for listening today, and if you need any more advice on this, you can get in contact with me or subscribe to my page, because I will keep making videos on therapy and how to have good therapy and how to use therapy. And I wish you all the best.